State your name.
My name is Bill Richard. I recently retired after 32 years from the substance abuse treatment profession as a master's level addiction counselor. Throughout my career, I've had the opportunity to work with 7,000 addicts and alcoholics as well as their family members. I also have a 36-year history of recovery from drug addiction. I've come here today to help clear up some of the misconceptions associated with adult cannabis usage and review the benefits of full legalization for cannabis, especially for veterans for home grow and in the use of treatment. I know this is controversial, but when we look at the number of drug-related deaths and costs society pays due to addiction, it's easy to see we are not winning the battle of addiction and mental health problems. Our jails are overcrowded, our mental health systems are stretched to capacity while addiction runs rampant. As a former professional in the treatment of addiction, I asked myself, what can we do? In my opinion, the first thing that must happen is for our society to stop demonizing the cannabis plant and associating its usage with poor and underprivileged members of our society and begin to recognize the powerful healing abilities of cannabis, especially among the addicted population. The cannabis herb has been used medically for thousands of years. The latest studies and findings continue to prove the power and therapeutic efficacy of cannabis. So why does cannabis work so well? It's pretty difficult to explain, but it's because of the endocannabinoid system that God has put into our bodies. We have these receptors throughout our bodies, and when one puts a phytocannabinoid, means grown by the sun, into the body, it begins to activate that system the way it was designed to. It helps regulate or influence anxiety, feeding behavior, appetite, emotional behavior, depression, nervous functions, neurogenesis, neuroprotection, reward, cognition, learning, memory, pain, and a lot more. So using marijuana in addiction recovery, according to NIDA, is now funding several projects that will investigate the use of THC for treatment of addiction, especially for opioid addiction. It helps control withdrawal symptoms and craving reduction. It helps with pain management, anxiety, depression, and it is a way of harm reduction. By providing the cannabis plant, individuals may be less likely to turn to more harmful substances, therefore reducing the risk of overdose and other negative health consequences. It helps with sleep improvement. It helps enhance their mood. In my opinion, the biggest crime associated with cannabis is not supporting the legalization of it, while our mental health system supports the proliferation of prescribing a substance with more addictive properties than heroin called Suboxone or buprenorphine. How can a substance abuse treatment industry recognize the efficacy of such an addictive substance of Suboxone while it demonizes marijuana and THC? What boggles my mind is the substance abuse treatment industry is the use of Suboxone as a replacement therapy for opioid dependency. According to American Addiction Centers, the development of a substance use disorder is an inevitable physical consequence of ongoing substance abuse. So we're trading one addictive substance for an equally addictive other substance. If the billions of dollars spent on Suboxone initiative worked, then why do we see the increase in drug uses and associated deaths in crime and mental health problems? So I leave this panel with one comment. It is my opinion that going beyond our old, archaic, and non-substantive belief regarding THC and other cannabinoids will allow us to progress to a more practical treatment of substance abuse problems with the potential of better outcomes. It is my hope that this legislative body can consider the research and broaden their ideas regarding full legalization of cannabis for the citizens of Louisiana and the veterans for home grow. Thank you very much.
Thank you, Mr. Richard. The board is clear. Thank